Easy. So the question was, how can we be sure there are no medium or long-term side effects to the vaccine, Dr. Bnar?
Yeah, thank you. So as I said, we have been vaccinating for many decades and have vaccinated millions of people every year in those decades. And what we know about vaccines is actually when it comes to side effects, they are the safest treatment intervention that we can offer. They're actually safer than things like paracetamol and ibuprofen, which you could buy over the counter. They have fewer side effects and we know more about their side effects. And what we know is that 90% of side effects appear within the first few days, and they're the ones that I mentioned in that. And the other 10%, the rarer side effects, appear within 3 weeks, but they are all mild and they are all reversible. And this is not different for these vaccines because they do the same thing. So there is no reason to be worried about long-term side effects. The thing that I want to highlight here is that having the vaccine will protect you against COVID. But if someone who's had the vaccine was going to have a heart attack and die from a heart attack, it's not going to stop that. So when we vaccinate our elderly population who have lots of other health problems and they don't get COVID, great, that's what the vaccine's supposed to do, but they keep dying of all the other things that kills old people, like their heart problems, cancers. That doesn't mean the vaccine isn't working. That just means they didn't die from COVID sooner, so the vaccine did its job. Does that make sense? So please don't be alarmed if you hear elderly person had the vaccine and then died a year or months or whatever later. We need to figure out what they died from, and I will guarantee you that it will be because of underlying health problems. But we investigate this very, very carefully before we can carry on vaccinating. Okay, so just be reassured when you hear things like that, please.
Yeah, that makes a lot of sense in the sense of like people kind of, you know, if they've had the jab and then kind of scapegoating any other ailments to the COVID. So yeah, COVID vaccine rather. Yeah, that's a very good point. And the whole purpose of the vaccine is to prevent you from getting COVID, not to make you immune to it and every other condition out there, right?
And that's one of the reasons why you have to wait a month after catching coronavirus for the vaccine, because some people can have symptoms of coronavirus and the after effects of coronavirus for up to 28 days, if not longer. So it's very easy then to have if you have the vaccine within 1 or 2 weeks, to attribute tiredness, lethargy, headache, chest pain, breathing difficulties, not being able to go back to work. This is what the kinds of patients that me and Dr. Naseem are seeing, these long COVID, wrongly to the vaccine, when actually it's still the lingering COVID and the after effects. No one talks about the long-term effects of COVID or the medium-term effects of COVID, but they all want to know the long-term effects of the vaccine. And we are seeing long COVID and how this has impacted fit and well people who are still not going back to work. I have at least 5 or 6 patients, young, fit and well, who are not able to go back to work 2 or 3 months after catching coronavirus with no underlying medical problems.
And the symptoms they present with are so varied, aren't they?
Yeah.
The other point there is that when you've had your vaccine, it takes 2 weeks for your immune system to kick into gear. So if you have your vaccine, you can still catch COVID in the 2 weeks until your immune system gives you that protection. Does not mean the vaccine is failing. That's just how long your body needs to be able to read the vaccine and say, okay, I'm going to get my soldiers ready. Okay, that's why when we get preliminary data saying, oh, this country's vaccinated X percentage, but people are still catching COVID, that's not anything to worry about. It just needs a bit more time for the population's immune system to catch up and actually get the protection of the vaccine.
Yeah, that makes sense. Okay.